Hi everyone, welcome to our basic cell saver setup video. Here we're going to show you how to set up the cell saver and all the supplies needed. Here's an overview of the supplies we'll need and be using. First up is your suction and anticoagulation line. Here we have our reservoir. This is suction tubing. Here we have our bowl. And this is just our PAL filter. So this is the Medtronic Autolog cell saver. We'll first start off with opening up the reservoir. Make sure all the caps are tight. You want to keep everything sterile. And then there's going to be a little tube attached to the side of it. You're going to take that tape off. And make sure you close that white cricket clamp. And now you're going to connect that tube to the bottom of the reservoir. And make sure you put it on tightly, get that past the second barb. Once that's ready, you'll just put that in its holder. Next up, you're going to get the suction line. So make sure that connects to the top of that reservoir. And then you're also going to get the vacuum line. You're going to measure it to where that yellow cap is on the reservoir. Once you've measured it properly, you can take off that yellow cap and attach the tube onto the reservoir. So next up will be our effluent bag. Make sure you tighten that cap at the bottom, and you're going to put that on the side of the cell saver machine. There you have a little holder for you to put the rest of your materials on. So you're going to put up your red blood cells bag. Make sure you clamp both outside cricket clamps to make sure nothing leaks. So that is our bowl. You want to make sure that that yellow cap right there will touch the other yellow cap that's connected to your effluent bag. And you want to make sure that the bowl aligns with how you're going to place it inside. So there should be a little crevice there to where you push down and you turn it to the right and it will lock in. And that effluent line of those two yellow caps, like I said earlier, you will connect those two sterilely. So continuing with that bowl, you're just going to grab that continuous tubing and you're going to put it around that circular area and put that little triangle piece into its proper place. If you do it the opposite way, it won't fit in properly, and you want to make sure those three tubes align correctly as well. So you'll just push back on that little lever, make sure that tube goes all the way in that circular area. Once that's all fit in, you push that down and pull that lever to the side and have it locked. So that line right there will go to the bottom of the reservoir. So it's just connecting the line that will drain the blood to push into the bowl. This next line is going to be connected to your saline bags, which we will show in a minute. And that third line goes all the way up to your red blood cells bag. So here's where we're just putting our saline bags up. Some places can use sodium chloride, some places can use ACD, just depends on the hospital. If you use sodium chloride, just make sure you add heparin into that bag, and typically they've been adding 30,000 units of international units of heparin. So you'll just turn on the machine. And make sure you clamp those 2 lines before spiking. And that'll be used to just wash out and separate those red blood cells from everything else. Just hit that green play button and it'll start to auto prime. And this line right here that's being attached is the cell saver line that comes directly from the field and is sterile. So you'll attach it to your reservoir, and then you'll be spiking either that ACD or sodium chloride with heparin bag. And you'll put it on a drip, and it'll just help the blood from clotting.